day, everyone, and welcome to today's webinar, Preparing for 2026 Language Access Standards and Compliance Requirements. Our speaker today is Dr. Tatiana Gonzalez-Sestari, PhD, CHI Spanish, Director of Language Services Advocacy at Equity. Tatiana has 23 years of combined experience as a pharmacist, pharmacologist, researcher, professor, I'm sorry about the dog, leader, and remote interpreter. She focuses on hospitals' language access, best practice, and impact on quality, compliance, and financial metrics. Tatiana is part of the NCIHC Policy, Education, and Research Committee, the SAFE AI Task Force, and co-author of the Remote Interpreter Textbook. At this time, all lines have been placed on mute to prevent any background noise. We will have a question and answer period at the end of the presentation. I believe there's a couple of polls in the beginning. Type your questions using the question prompt, and they'll be answered in the order they were received. Please identify the name of your organization. At the beginning, this webinar is being recorded and will be available in the CIHQ YouTube library within a couple of business days. I'm going to share the presentation. We had some difficulty getting permission for Tatiana to do it, so just forgive our back and forth with the slides. So I'm going to begin the presentation now. In the beginning. Tati, you have the floor.
Thank you so much, Michelle. I'm not able to see your screen. I just want to make sure that everybody can. There we go. Now I'm able to. Perfect. All right. Thank you so much. First of all, thank you for having me here. I'm glad your dog barked, just in case. Mine may too, just as a reply to your dog. Hopefully it doesn't happen, but I'm very happy to be here today. I'm excited to talk a little bit about what we have, the content that we have here for you today. And it has to do with language access services and being ready for it and being compliant in 2026. A little bit about me. I have been in language access for about 13 years. I've been a remote interpreter, medical, nationally certified healthcare interpreter, and I've been in healthcare for more than 23 years. I am a pharmacist and a pharmacologist, and I've been in education, research, and also in clinical settings my entire career. So I'm very excited to share with you a little bit about what I'm passionate about during this conversation. And for those of you listening, please utilize the Q&A feature. Let's make it a little interactive. We have a few polls as well. So make sure you add questions, comments there. And if the chat is available, you can use that too. And Michelle, I'm not sure if I heard you correctly. Is the chat is the chat an option for our attendees?
Yes, ma'am. Chat should be an option for you. And if you don't see it, then the question block is also perfect.
Perfect. All right. And of course, I have access to all that. But if for some reason I miss it, we'll try to answer or talk about that comment as I see them. All right. Okay. So as I was saying, my background is not only in healthcare interpreting, language interpreting, but also pharmacy, pharmacology. And I serve right now as the Director of Language Service Advocacy at Equity Health. And I've been with this company for about, well, pretty much the same time I've been in the industry for 13 years. And I would say that it's very interesting to be able to, and actually good, to be able to put together different things that I really like under the same umbrella. So I've been able to do that in my career. And if we go to the next slide, All right, so let's talk a little bit about what we would like to accomplish today. And of course, I can be talking about this topic for many, many hours, but we only have now less than an hour to cover what we have here today. But in theory, we would like to leave you with where and how to involve language access services throughout the patient experience to improve compliance. We would like for you to be able to identify the key components of language access services and relevant compliance requirements. And we will also talk about evaluating and applying criteria that define value based on efficiency, compliance, and patient safety, as you see here. Now, objectives 2 and 3 are going to be very straightforward, but I want you to pay attention about objective 1. We won't have necessarily a specific slide or content prepared for that one, because in reality, you're going to see it throughout the presentation, okay? It's more straightforward with objective number 2 and number 3 as we go through the content. If we can go to the next slide, please. All right, so this is my question for you to start the conversation. What does it mean to involve language access services through the patient experience? What does that mean to you? You can answer in the chat. Actually, preferably in the chat is easier to see it for me. So what does it mean to involve language access services throughout the patient experience? Come on, don't be shy. Does it mean to have interpreters? Does it mean to...
We have a response in the question poll. It means more robust communication and effective healthcare.
Okay. What does that mean exactly? Clear understanding of what's happening. Hospitals can be frightening. Okay. How do we achieve that?
And providing the patient with information related to their condition / experience in a language that they understand.
Absolutely. Mm-hmm.
It ensures effective communication, allowing patients, and provides the opportunity to connect and understand each other.
All right. Okay, I really like your answers. I could take all of them and I think they're really good. Now the exercise is to go from, let's say, this high level of answer that we have right now to more specific ways to achieve that, having language access services throughout the patient experience. So yes, I agree with you and I like your answer. Now, if I asked you, how would you specifically do that? Or what tools would you use? What would you say?
Great comments. How to obtain reliable information from patient. Can someone share a policy sample? That's a question.
Okay, so having policy, I like that. What else?
Let's see, engaging in a language vendor and employed medically certified interpreters, excuse me.
All right.
Material.
Go ahead. I was going to say.
A communication sample and the initial assessment and documentation. Very nice.
Yes, absolutely. So vendors for interpretation. I'm sorry, I missed. Having, somebody said hiring certified medical interpreters. Any other tool option?
More robust communication and effective healthcare.
Okay, how exactly? Or what tools would you use to achieve that?
There's a lot of questions. An assessment tool, a policy and unit protocols, staff to ensure accessibility, qualified staff. Let's see. So this is usually down in the nursing assessment.
Perfect. So there's documentation as well. All right, I think we have fairly good list of tools or ways in which we can involve language access services throughout the patient experience. Now, and in this part of what we're going to be talking about today, if we can go to the next slide, please. So there are many different ways in which we can provide language access, and it's very important to think about how we're going to do it this year and of course in the future. This industry is evolving rapidly, and there are many ways in which we can provide language services. Of course, as many of you mentioned, having a well-established language access plan and policies and procedures is key, because if we don't have that, there's no way we can know what's going to happen, how we're going to do things. There's no way to plan and be able to really evaluate if we're being efficient and effective with our approaches. Part of providing language access services, as many of you also said, has to do with the different tools that are at our disposal to provide services. One of which is providing interpreting services, and that can be in the form of on-site interpreting, which is also referred to as face-to-face, or remote interpreting via telephonic interpreting or video remote interpreting through, let's say, an application or a tablet device that it's utilized to connect with an interpreter. Also, there's audio only through these applications as well, etc. So those are different modalities. And also we think about a different way to provide language access services through translations. So interpreting is when there's a conversion between one language and another in a oral, verbal type of communication. Translation is from one text to another form of text. So translations are key when it comes to providing documents to patients who use a different language, a language other than English. Also, translations can be applied to websites, to any patient portal, or maybe even our social media, you know, so that we can reach the populations that use those other languages. Somebody mentioned bilingual staff or qualified staff. This one in particular refers to an individual who uses a language other than English for language concordant care, or directly communicating with a patient in that non-English language. For example, I am fluent in Spanish, and I provide proof that I'm fluent in that language to my hospital, the hospital in which I work, and I'm a nurse, and I can speak to, once I pass that test and provide proof that I'm bilingual, I'm able to talk to my patients in Spanish. But, and this is a very important distinction, I may be bilingual, but if my hospital doesn't have proof that I'm bilingual, I should not be using Spanish to communicate with my patients because I won't be compliant with Section 1557 of the Affordable Care Act. So even though I am bilingual, if my hospital doesn't have proof of that, then the hospital is not compliant with the law in order to have someone to prove that I'm bilingual, okay? In addition to that, that language access, let's say, program for 2026 will need to have different ways in which technology is leveraged to be able to access the services. For example, it's very common now to have language services embedded or integrated into electronic healthcare record systems. Also via telehealth, to make sure that when there's telehealth visits happening, there's language access services also added to the system, like directly embedded in the service. And of course, as we mentioned, I mentioned earlier, making sure that patient portals are also in the languages that are needed for our patients. In addition to that, there are many other things that go beyond that interaction, let's say patient provider through an interpreter or giving translated documents to patients. And it's more about the quality of the services that are provided, language access services, whether it is through our own staff at hospitals or through vendors. A key component, and I'm sure you would appreciate this, is quality assurance, making sure that the services that are provided are of high quality. And when I say quality, is because we're measuring that. So to me, quality is quantifiable. So it's not just, oh, that interpreter did a good job. Well, based on what and what's the criteria? And I apologize if you hear my dog right now. She's trying to get my attention. So that is part of what I mean with quality assurance, making sure that it is actually something that we're measuring. What was the, let's say, encounter accurate? Was were all the tools available for the communication to happen? And how about some metrics to actually know if there was satisfaction during the encounter, etc. In addition to that, it's very important to have ways to maintain not only high quality, but if there are any issues that all of those, let's say, vendors or even our departments, language service departments or patient experience departments with the hospitals have good customer support. And that can be in many different ways, which include also my next bullet point, which is technical support. If you have any, of course, technology helping with the provision of language services, you need to have technical support. Also, if there's an issue and you have to put some sort of complaint, how is that being resolved? Are there, protocols in place or procedures in place to be able to manage the situation and improve? In addition to all this, are you able to access data about not only, let's say, how many times you access an interpreter or how many documents needed to be translated, but also, if you need devices, how many devices you need and where's the utilization? Or maybe in hospital A, you have a big population, I'm still in the previous one, thank you. You have a bigger population of Haitian Creole speakers versus Spanish speakers or Cantonese speakers. How do you handle those situations, even with your own staff interpreters, okay? And of course, there are many other things that go with the policies, and a lot of it has to do with privacy and security of the information. I'm sure you're very familiar with that because that's a big part of what you need to know within your hospital system. So that part is not that different from many other things that have to do with privacy and confidentiality and security of the information. And I would say that you need to involve your language service department in any of the things that I mentioned right now, and not only to manage relationships and to manage the services, but to also be able to select the services or maybe select vendors or make the decisions when it comes to providing the services, and then how to manage the relationships with other departments. And of course, that goes with a comment I have down here, that when making decisions or contracting for services, somebody needs to help define what's the scope, what's in it or out of scope. And that will be a person who's an expert in language access services. Okay, we can go to the next slide. All right, so I won't say too much about this because it's extensive, but know that it is the law to provide language access services. And there's several laws that mandate this, and you have there the Affordable Care Act, specifically Section 1557, the Americans with Disabilities Act, and Title VI of the Civil Rights Act. And the bottom two are basically standards that can guide the provision of language access services. Next. All right, so in addition to, let's say, being the right thing to do, also in addition to being the law to provide language services, I would like you to take a moment to think about what would make a patient go to your hospital versus the hospital across the street or another hospital in your community. If you want to share what that is, that'd be great too. Michelle, let me know if you see any comments. What will make a patient go to your hospital versus another hospital in your city or neighborhood?
I have a question about options to prove that staff are bilingual. Culture and community is one response. Thank you, Gretchen. Access to services. Thank you, William.
Yeah, access to services, absolutely.
Offered and provided. Wonderful. Thank you.
Absolutely, yes.
Personalized service and high quality of care. Wonderful.
Yes, absolutely. And many times that starts with simply, you know, my neighbor, my friend, my cousin went to hospital A and they had interpreters, or they had ways for me to access interpreting services that hospital B doesn't have. Okay, so word of mouth is extremely important in the communities that need language access services. Maybe also in the English-speaking community, but I would tell you, since we're talking about language access, that for sure is a big one. If we can go to the next slide. All right, so I think it will be important for you to think about this and even ask your team some of these questions. And in just a moment, I'll answer the question that was posted earlier. So if you're not involved in language services, find someone to ask these questions in your hospital. Does your hospital have a language access plan, policies, and procedures? If you have staff interpreters or you work with vendors, are interpreters trained, and how are they trained? And I mention these questions because I'm involved in many proposals, and I have an understanding of what it means to maybe have contractors or have contracts with vendors when it comes to language services. And many times the questions that are asked are too basic, too big, that they don't allow us to really dig deep into what's needed in language access services. Another question here is your staff, hospital staff, trained to timely access language access services? Because if not, then there's another issue, compliance issue there. When I say timely access, I mean that they're able to provide the service right away without asking someone else, how do I find an interpreter? How do I access interpreting services? How do I use this device for interpretation? Okay. I mentioned modalities of interpreting earlier. Do you offer all modalities? Having a robust language access program means that you have all the modalities available so that you can provide the services when needed, and each modality is good for different things. So the more you have the different modalities and you build on that, the more robust your language access program will be. And of course, based on some of the comments I made earlier regarding technology, how does your hospital leverage technology for greater efficiency in providing services? Okay, if we can go to the next slide, please. All right. Terminology shapes equity and expectations. Not only that, but the right terminology also prevents misunderstandings. So that's why I brought these terms here. As you see, we tend to use limited English proficient or LEP patient population. We can go back one. Thank you. Because it's the legal term, okay? We see that term in the law, and that's why we use it. But in reality, it's a term that tends to be used in a derogatory way, or it has a negative connotation because, and this is human nature, it's not no one's fault specifically. We tend to think that someone who doesn't speak English doesn't have, let's say, the educational background or the same background as someone who does, or social economical background of someone who does. Okay, so in the field, we tend to use something else in this industry, like patient who prefer a language other than English, or a patient who may need language access services, or someone who is culturally and linguistically diverse who may need services, etc. So when you work with your teams and look at documents and stuff like that, if you don't need to use LDP, please use something else, because that's going to help overall with the culture of the system when it comes to providing the services. And then using versus working with an interpreter. And this is someone I see constantly, and I still see it, even though I've started a big campaign to be able to not have that. When you contract with medical doctors or you hire nurses, do you say that you use doctors, or I'm gonna use this dentist for my treatment, versus I work with, or I want this person to see me, right? Or I'm seen by this doctor. But for some reason in this industry, we've been using the verb to use when providing, when an interpreter is provided for interpretation. And also knowing the difference between interpreting and translation, which is, as I mentioned earlier, translation is from written to written, and interpreting is from oral to oral. Okay, we can go to the next slide. Oh yeah, all right, so in healthcare, value is defined as the quality of care divided by the cost of care, where higher quality outcomes for a lower price result in bigger or greater value. Now, in language I would say in the language access industry of 2026 and beyond, price and cost are only a fraction of the factors that must be taken into account. Among other factors are the key performance indicators and of course their corresponding benchmarks that any language service department and vendors should have. And also many of you that are maybe in the quality department, risk management, patient experience, etc., should look at, okay? So these KPIs are not only related to an interpreted session, they go beyond that to demonstrate high quality and customer service overall. Examples are, as you see here, fulfillment rate. That is for both, let's say, interpreting and translations as well. For interpreting, it would look like how many times an interpreter was requested, and of those times, how many were fulfilled. Whether it's on-site or remotely, was an interpreter provided. In translations, for example, 100 documents were sent for translation, how many of them were actually translated, and how long did it take for the person, the department, or the vendor to give us the result or the translated content. Quality assurance scores. If you work with remote interpreters, whether it's through vendors or your own, I'm sure many companies already have quality assurance program already established with a rubric to evaluate interpreters, not only the accuracy of the interpretation, but also customer service and many of the other skills that interpreters need to have. Average speed to answer for remote interpreting. If the interpreters are qualified and are trained, and how many they are, to be able to provide services in healthcare. Punctuality of on-site interpreters. Satisfaction of any of the services, whether it's translation services, interpreting services, the overall satisfaction with the program. And these measures can come, or the answer to, let's say, surveys or questions regarding satisfaction may come from your patients, but also other hospital staff members, okay? And of course, if there are any issues, you need to have key performance indicators about case resolution, how many cases have been submitted, how many have been resolved, how long it took to resolve them, etc. So these are very specific to this industry, but at the same time, they apply to many things in the hospital. And as the industry continues to evolve, more key performance indicators will be developed as well. Now, I want to mention briefly that for many years, the language access industry has been built around qualitative, I should say, qualitative or subjective data more than objective and quantitative. But in the last few years, we're moving towards a more objective and quantifiable industry and data, which makes me really happy. And the reason why I mention this is because in the past, you may have not needed all these KPIs to justify and plan ahead. But now more than ever, we need those pieces of data to be able to justify not only our program, but also to plan ahead when providing language access services. So that's why I added here in that language access plan and program of 2026. If we can go to the next slide, please. All right, so let's talk about AI for a moment. Sometimes AI is the elephant in the room when it comes to language services because of the limited accuracy in specialized environments, for example, in science or healthcare, also for the lack of cultural component. But one thing that is true about AI is that it's very trendy right now, okay? And it's also trendy to say that AI can do everything. And yes, AI can help with a lot, but let me show you here how, how the industry is seeing AI, the language access industry is seeing AI when it comes to how much technology can be embedded in interpreting. So as you see in this schematic, you have more human interactions on the left-hand side. If you go to the right-hand side, it's more AI interactions. So the two extremes are on the left-hand side, for example, human interpretation with no technology assistance and let's say on-site interpreting, etc. That's human first and human only. Then the opposite side of the slide or this spectrum is more AI or AI only. AI interpretation, no human assistance, and AI is the first option and only option. Then we have several layers in between. We have, for example, human interpretation with remote through remote systems, like what we know right now as video remote interpreting and over the phone interpreting. We have human interpretation with computer-aided interpreting systems. We also have human interpretation with AI-enabled quality assurance and validation. That doesn't mean that the human component is gone. It's just that AI or technology is helping support interpreting, but the interpreting is being done by a human. And then we enter into AI interpretation, let's say with real-time human validation, making sure that what AI is, the output from AI is correct, okay? It's accurate. And then it goes all the way to AI interpreting, no humans involved at all. And where we see the sweet spot right now is where you see it would be the second, third, and fourth sections on the left-hand side, starting from the left-hand side, that we label their patient experience sweet spot, where there's still the need for a human component in interpreting. And of course, it can go from, in some cases, on-site to through remote interpreting, VRI, OPI, all the way to maybe have AI and some technologies help making sure that the human interpreter was fully accurate, that all the things are in place, and all the terminology was as culturally appropriate and sensitive as it should be, okay? You know what, I just realized, Michelle, I never answer. You know what, we have one more slide and then we can answer the question that was posted earlier. All right, so also regarding AI, there are a few risks involved in AI translated or AI aided translations. Remember, the translations, the written material, because translations, they have already a quality assurance process embedded. When, whether it's a human or a machine helps translate content, that content is typically reviewed by someone else, a reviewer, an editor, and then the final product is given to the client. So that quality assurance process is already embedded in the system, which is not the same for interpreting. Interpreting is in real time. There's no time to review what the interpreter said and then correct it, unless the interpreter or someone else realized that there was somebody made a mistake, okay? Now, it's important to know that AI can support many other things that are not necessarily the act of interpreting. For example, scheduling of interpreters, scheduling of services, triage of patients. Let's say AI may be helpful at recognizing what language somebody speaks, okay? And then let the human know that an interpreter is needed and for what language, or let the computer know that this patient speaks Spanish or French, and that information should be added to the electronic health record system. It can be used, as I mentioned earlier, for quality assurance, or in some applications, as we've seen in some hospitals right now, non-clinical interpreting. Even though everything comes down to clinical, there's some hospitals in the United States that have tried AI-aided or AI interpreting for when patients place an order, food order to the cafeteria. Of course, not of course, but I would say that names of foods are also difficult to interpret. So I want to see how AI will deal with that. There's risk in interpreting when it comes to AI interpreting. We have noticed, and I'm sure you're familiar with this, that AI will have the biases of the input provided to build that AI tool. And AI is not able to have contextual or cultural understanding. So that is very important when it comes to communication, because language and cultures go hand in hand, okay? And I mentioned already the risk of translations. If we can go to the next slide, please. All right, so a few things for you to keep in mind when you are contracting with vendors to provide language access services, and it is that you need to ask for them to be transparent and realistic, and also expect realistic pricing models and the KPIs and service agreements, okay? Ask for them to provide proof of testing, training, staffing models, qualifications or certifications of interpreters, for example, and translators. Ask about their security practices and fair pay, okay? And last but not least, know that your hospital remains responsible for compliance, not vendors, okay? When I say this, I mean, for example, and this is a very common example, you contract with 1 or 2 vendors to provide language access services. And I would say right now in the United States, a vendor may reach the ability to provide services in 300 languages, but there are more than 7,000 languages spoken in the world, and more than 300 languages spoken in the United States or used in the United States. What if you happen to have a patient in your facilities that speak a language that's very rare in the world, and even more rare, more rare in the United States? Fortunately or unfortunately, providing language access services to that person is not a vendor's responsibility. Vendors will try to accommodate as much as possible, but what if there's no interpreter available in their network or even in other vendors' networks? And of course, that's also difficult for you to deal with. However, know that that responsibility still remain under the hospital, okay? Now, you can try to partner with as many vendors and agencies to provide that service, but here and there you may have very rare exceptions in which there's no way to fulfill that request, okay? And if we go to the next slide. The same way, you need to have expectations and clear expectations from vendors and those who work providing services to your hospitals may have certain expectations. Same way, transparency and realistic expectations, service level agreement. Also, vendors would expect for you to know the state of the industry when it comes to training, qualifications, staffing models, technology advancements, etc. So that when we're trying to establish that relationship, you're not just choosing services or vendors or a contractor without knowing the service and the background that you need to have in order to have to contract with the right organization, vendor, agency, or person, however you call it, okay? And the same way, vendors are expecting for you to know that hospitals are responsible for compliance. We're there as tools to allow you and help you be compliant. And when I say we, because I also represent, of course, I represent a vendor, and that's part of a good and transparent relationship, healthy relationship between vendors and hospitals. Next slide, please. All right, so that's pretty much what I have for you today. And thank you very much for being here. Let's go through some of the questions we have here, Michelle.
Hey, Tati, this is Darcy, actually. I'm
Hi,
going to help
Darcy.
moderate the questions. And I just want to hit on some that came in earlier. And meanwhile, as other questions come in, please enter those in the question box and we'll answer those as well. So Tati, one question from earlier that you have touched on, but just to highlight again, is there was a request for a policy example or sample or example. So can you provide some context around that?
Yes, okay, so a policy for language access services would need to have, it doesn't have to be extensive, but it will go, the length of it will depend on the dynamics of your hospital. I've seen policies that are only one paragraph, because the importance of the policy is to say that your hospital provides language access services for free to patients, okay? Now, how you provide the services can go in the policy or can go in plan or different documents as procedures. How do you actually access those services? I would say that the best way to start developing a policy or language access plan is to follow the class standards, okay? You can go online and find the culturally and linguistically appropriate services standards to start putting together that policy if you want to have everything in a policy. And the reason why I wanted to say this, the reason why I mentioned that some hospitals have very short policies, but then other documents that relate to that policy, versus some hospitals that have everything that has to do with language services in the policy, is because many times it's difficult to change a policy. If you need to make modifications, you have to go maybe through legal, maybe through different teams, compliance, etc., to be able to change, let's say, a phone number that was in this big, heavy policy, versus if you have a short policy and then several other documents, protocols, procedures, etc., and a plan, those are easier to change if you need to make any modifications. Darcy, I think there was a question earlier about bilingual staff. I don't know if I answered it.
Yes, okay. You're right. There were several versions of that. So a few different people, let me read you all the questions because there's a couple of nuance in there. So one person said, is there a standard exam or tool to demonstrate proficiency? Another person asked, is there an assessment to establish with staff we have who are bilingual? And another person said, how do bilingual staff prove they are qualified? Are there testing options available? What are options that we can prove? So kind of several flavors of that same question.
Perfect, thank you. All right, so the answer is there's no one specific way to prove proficiency. However, the tool that's used most of the time is a test, a fluency test, okay? Now, I've seen in hospitals here in the United States different things to prove that you're bilingual, but I think the most reliable right now is a fluency test. A fluency test in your non-English language, testing the type of terminology that you are going to be using. I make this distinction because if you're a clinical staff or you have clinical staff who are bilingual, you need to test their ability not only to be fluent in that non-English language, but that they have the knowledge and the terminology, the clinical terminology, to be able to talk to the patients with that terminology. If you have administrative bilingual staff, then they would need to have that type of terminology. So let's say your non-clinical staff doesn't need to have necessarily the clinical terminology, but your clinical staff does need to have that clinical terminology, okay? So there are different types of tests out there. Many organizations, many companies offer these fluency assessments in many, many different languages. I would say that to me is the best way to say that the person is qualified to be a bilingual staff. There are other examples out there. Some people take, let's say, the certificate, or let's say graduation certificate of a person who did their studies in another country. That should work. However, I ask you to please make sure you don't allow these certificates to be, let's say, older than 5 years. I'm making this number up because I lived here in the United States and my first language is Spanish. And I've lived in the United States now for 20 years. My Spanish has suffered. Even though I try to keep up, it's hard to maintain it. So if that, let's say, medical doctor graduated from Spain or from Colombia 20 years ago, 10 years ago, and they haven't really used their medical terminology in Spanish for all these years, that terminology may not be as good as it was before, okay? So that's why I don't typically recommend that, but there are ways in which we can use that. Now, another way to prove that a person is qualified to be a bilingual staff member could be if there are no, the example of, or the extreme example of a person who speaks a language that's very rare and there's no fluency assessment available, maybe with proof that that person graduated from a university or a school, high school from that other country could help. So you try to go from the most thorough to what are other options to prove that, okay? And always think about, would the skills, language skills of this person be as good as they were when they took that assessment, or they took, they completed that course or degree in another country, so that you can have all that ready. And of course, if with time you see that whatever protocols or standards that you establish in your hospital is not working, you can review your language access plan in order to then start requesting a different type of proof. I know that was a long answer.
No, super helpful. Thank you, Tati. Okay, we had another question come in, and actually just a comment too, that this person's vendor offers this assessment for their non-clinical, and I'm guessing clinical staff. For compliance, what specific forms or documents are hospitals required to provide written versions in Spanish and French? What pathway recommendation do you recommend staff take in order to have these documents translated appropriately? And then this comment, we do not have medical interpreters in-house, but we utilize an online medical interpreter service. Are there free options for having our consents and other forms translated in other languages and reviewed when edits need to be made to these forms?
Okay, so it's a long question, but I think it's the most important part here is translating forms, translating documents into Spanish and French, right?
Mm-hmm.
And okay, so several things. For free, there are many things you can access for free. However, I would not rely on the accuracy of those tools, okay? Especially if it's, well, both medical terminology, but also even some common words are still not well translated based on the audience or based on who the consumer is going to be, okay? So actually, Darcy, can you start the question? Because I want to.
Yeah, sure. And I can summarize too. So one part of the question is which forms are required to be
Okay.
provided in Spanish and French, which I'm guessing a nuance of this is that depending where you live, you might have other highly utilized languages beyond Spanish and French. And then, you know what, let's answer that one first and then we'll come back to the next one.
Yeah. So basically according to language section 1557 of the Affordable Care Act, you need to at least translate vital documents. But the definition of vital documents varies among hospitals, okay? But if we take in general any document that will be vital, important for a patient to understand because it talks about their care, decisions, risks, procedures, legal consent, etc. All of those need to be translated. Now, I also, this is Tatiana's, this is not in the law, but in my common sense, I think it's also vital, anything that goes, any communication that I receive as a patient with, let's say, the results of my tests, or it might not be vital, but I need to understand when and where do I need to show up for an appointment, among other things. So it might be vital information to me to know about the qualifications of my doctors. Okay, now those are not, of course, I know legally those are not necessarily vital documents or information, but to me, those are very important and will make me make a decision or decide one thing versus another, depending on what I read or what I have in my hands, okay? So vital documents will be top, and then everything else that would support the patient will be next, okay?
Okay, then the next part of this question is what pathway recommendation do you recommend staff take in order to have these documents translated appropriately?
Okay, I would start by surveying or finding out how many documents you need to have translated, what are your top languages that, or knowing what are your top 10, 5 or 10 or 15 languages that are needed in your facilities. And I say this because that would help you determine how many languages, and also which ones are the most common languages utilized, so that you can probably send for translation those documents that you know are going to be needed, let's say for discharge instructions, in those top languages, versus developing now a process to translate documents in languages that are not common in your facilities. So one part is finding out all of this background information, number of languages. If you say with your top 10 languages, what's the percentage of the population I reach? Well, maybe maybe with my top 10 languages, I cover 90% of my population. So you can start with those. And then based on that information, develop a plan. Even if it's simple, just use blah vendor for translations, at least you have something in place. You can partner with vendors for translations. You can hire translators and have them as part of your team. You can contract directly with translators, depending of your hospital policies, of course, but you can also contract with them directly. So you have different ways to have that. And many translation companies have portals, etc., so they can help you kind of draft the procedures or protocols you want your staff to follow. So I know it's not as simple as it sounds, but you need to have a plan in place to be able to not only be proactive and have translated documents already in your system, but you also have to know what to do if somebody comes to your facilities and they use a language that you've never seen. Okay, so does your staff place a call, or do you have a portal or intranet or a link that your staff uses to access or to request translation services or something like that? I would start there.
Awesome. And then the final part of this, you touched on this already, but are there free options for having the consents and other forms? And you cautioned against using free tools because they're not going to have the reliable accuracy that you need when you're, especially, trying to make sure patients get the care they need, but also remain compliant. So the part of that you didn't address, I think, is just when edits need to be made to these forms. So I think your answer will likely be the same, right? You need to have a trusted vendor that you can use to get those edits made ongoing.
Absolutely, yeah. And actually, if you partner, a good vendor will tell you that there are ways to actually have a repository of those, and even small changes can be saved in like a library of terms, so that we know, or the vendors know, what languages or what specific words you use for the population you serve in your locations for a specific word in English, for example. Because think about how many ways you can say things in, let's say, English from the United States, English from Australia, English from England, etc. So we want to make sure, or vendors will want to make sure, that they use the word choice that better applies to the population you're serving. And one more thing that I wanted to say about free tools for translation is not only the accuracy, but another concern is the type of information you're sharing. In many of these tools, you add information that can contain PHI, or that can contain certain information that should not be out there, that should not be public. Okay, so be very careful when using these tools, because then all that information will be out there. Okay, so security, privacy, and confidentiality of the information, to me, is also an important point there.
Okay, great. And that was the list of our questions, Tatiana. Wow, sorry, Tatiana. And we are over time. So we wanted to go ahead and close out today. And really, thank you so much to CIHQ for the opportunity. And just a quick reminder to anyone who's joining, especially anyone who had to jump on late, that the recording of the webinar will be on the CIHQ YouTube channel in just a couple of business days. Tati, anything you wanted to say to close us out?
Just thank you for being here. Thank you for the conversation. These were great questions, and I hope to see you guys later.
Thank you so much. Have a great day, everyone.
Thanks,
Bye.
everyone.